This is Jonathan Wright, Dr. Wright from the Tahoma Clinic in Tukwila, Washington. This time, I'm going to be talking about how it is totally unnecessary to have toxemia of pregnancy. There was a heck of a lot of research done by one man on how to totally prevent having toxemia of pregnancy. Online, we're told that 70,000 women or so a year around the world die of toxemia of pregnancy. Those deaths are not necessary. Now, who is that one man I'm talking about? It's the Dr. Tom Brewer. And for those of you who want to read a lot of details, excuse me just a second. Here's Dr. Brewer's book. As you can see, it's called Metabolic Toxemia. It details what I'm going to tell you about briefly. Now, Dr. Brewer had read some papers published by Harvard professors. Well, I say it that way because I went to Harvard, and when I went there, they told me they knew everything. By some Harvard professors that gave him a very big clue. And that research is discussed in his book. So, when Dr. Brewer, who of course was an obstetrician gynecologist, arrived at New Orleans Charity Hospital, the rate of toxemia of pregnancy was over 50%. Now that's a lot. But toxemia was and is more common in charity wards, lower income, etc. Does that give a clue? Within a year, Dr. Brewer had the toxemia rate down to 0. And that's documented in that hospital's records. And for as long as Dr. Brewer was there, there was no more toxemia pregnancy. And he did not sprinkle fairy dust on people. He then went to a hospital in Florida where the same thing happened. The toxemia rate went down to 0. Yeah. And after Florida, Dr. Brewer was employed by the Contra Costa, if I'm pronouncing that properly, Contra Costa Public Health System in California, where again the toxemia rate went down to 0 after he arrived. How did he do it? One very simple measure, just one. A high-protein diet. Huh? High-protein diet prevents toxemia of pregnancy? Yeah, it does, and Dr. Brewer proved it. But of course, I'd read about Dr. Brewer's work, and if you remember, I had a lot of obstetrics and gynecology in school, and for the first few years of my medical practice, I helped a lot of women deliver their babies at home. I got some experience with this too, not near as much as Dr. Brewer. Oh yes, and those 2 papers by Harvard professors that he relied upon had found that the toxemia rate went down as the protein went up in the diet. A high-protein diet, reducing the risk of toxemia to 0. All in here. I had one failure, and let me tell you about how it proved Dr. Brewer's thesis. Actually, Dr. Brewer proved his own thesis. It just backed it up. Here I am in the Seattle area. A woman called to consult over the phone. She'd lost 2 pregnancies to toxemia. She wanted to know how to prevent a 3rd. I told her about Dr. Brewer's book. She got it. She ate a high-protein diet and she lost a 3rd baby. That lady was persistent. She got on the phone again and said, there must be something going on. Everybody else this worked for, why not me? I said, I'm sorry, you'll have to come to Seattle because we have to test your stomach to see if it's digesting protein. Digestion of protein is done with acid and pepsin made by the stomach. She said, really? I said, yeah, I'm sorry, I can't tell you that over the phone. So she got on an airplane, flew to Seattle, we did a stomach test, and you know what? You could guess. Her stomach was making scarcely any acid at all. And yet she didn't have any symptoms. She didn't have the gas, the bloating, the indigestion, the other things that usually come with low stomach acid. So, she took several hydrochloric acid pepsin capsules with meals, ate her high-protein diet, and her 4th pregnancy resulted in a successful childbirth, and she had no toxemia. As I said, that underlines just what Dr. Brewer had to say, that the high-protein diet, when properly digested, if you've had this problem before, you don't need to have it again. And if you know of someone who's having this problem, please refer them to Dr. Brewer's book, Thomas Brewer, Metabolic Toxemia, and let's spread the word. Thank you for watching and listening.